We are live. We are live. It's Medical Monday. I'm Dr. Frita, and it's time for more hot health headlines in the news. We're going to talk about all of the hot health topics. Today, we've got quite a bit because we're talking about caffeine. Raise your hand if you drink caffeine. Well, raise your hand if your teenagers are drinking caffeine. Well, you might not raise your hand, but they could be drinking it because guess what? We're having an increase in the amount of middle schoolers showing up in the ER with excessive amounts of caffeine. So we'll talk about the dangers of caffeine, how to recognize the symptoms, and how to find out if you yourself are drinking too much caffeine. We'll talk about myth versus fact. And then I'll move into giving you your weekly dose of news. Let's talk blood sugar. The CDC reports that the number of people with diabetes has doubled in the last 20 years. Yes, some of that can be genetic, but a lot of it is lifestyle. So we'll talk about the dangers of diabetes and what you need to do. And then we'll talk about the legendary Quincy Jones. He's touched our lives with so much music in so many ways that a lot of us don't even know. Well, Quincy Jones has recently passed away at the age of 91. So we'll talk about him, talk about his legacy, and we'll also talk about some of the health issues he was struggling with, including brain aneurysms. Yeah, we'll get into that. And then speaking of brain aneurysms, we'll talk about a mother who almost lost her life to a brain aneurysm at the age of 38. And so I'll tell you what the warning signs are and how to know if you're even at risk for an aneurysm. Next, we'll keep on moving and we will talk about some exercises that can help you to lower your blood pressure naturally. And then for those of you who are familiar with Dawson's Creek, one of the Dawson's Creek stars shared that he was diagnosed with colon cancer while he was only in his 40s. And so please make sure that you give him your questions because as always, we will have a live Q&A. Get your questions ready. We'll have those at the end. So go ahead, like this video and share it as we get into this intro. Hello. We're live. I'm Dr. Frita. Go ahead and like this video and share it because I'm giving you evidence-based medicine today as we get into these hot health topics in the headlines. I'd like to call up my co-host and practice manager, Shador. Come on up. How you doing, Shador?
Oh, well, how are you?
I'm doing pretty well. I hope you had a good weekend. Did I have a good weekend? Oh, I had a very eventful weekend. This last week was a bit of a journey for me, Shador, because I'm a doctor every day of the week. But this last week, I was actually a patient. I scheduled 4 different doctor's appointments. Don't ask me why I did that in 1 week. And then it wasn't even my happiest week. I had a rough Tuesday night, but we're here. It's Medical Monday, and we're going to give some evidence-based health information. All right. Shador, I want to ask the good folks in the chat. Put a 1 in the chat if you drink caffeine every day or almost every day. That's what I'm going to ask them to do because there are different reports, Shador, going on about caffeine uses, not just in adults, but in children and middle schoolers to the point where we have some middle schoolers who are actually showing up to the ER and they've had too much caffeine. They've had symptoms of caffeine overdose. So who was the first person in the chat today?
Yes, our first person today was actually Planet Life, who checked in early. Hello.
Hey, Planet Life. Welcome. All right. Do we have any caffeine drinkers? Put a 1 in the chat if you drink caffeine every day or almost every day.
Yes, we do.
Who are our caffeine drinkers? Because we're going to talk about this.
Sherry.
Hi, Sherry.
Imelda,
you're a caffeine drinker too.
Mm-hmm. And Athea says only tea.
Only tea. Okay. Tea does have caffeine though. All right. Okay.
And Shelly.
Hi, Shelly. So every day or almost every day. That's a lot of caffeine because guess what? Caffeine is the most widely used drug in the world. And yes, caffeine is a drug. And yes, I definitely do drink caffeine. I'm a fake caffeine drinker. I'm more of a habit caffeine drinker. If we have it in the office, Shador, you know this, and I'll drink caffeine. But on the weekends, if I don't have it around, I'm not at work, I'm not really drinking it. But Most people drink it. It's the most widely used drug in the world. And to be honest, most people with the amount of caffeine that they're drinking, and we'll get into it, do just fine. There's nothing to worry about. But we do have a bit of a crisis going on because a lot of our young people, including our middle schoolers, are drinking caffeine. Let's roll this first clip on teenagers and middle schoolers who are drinking caffeine, Shador.
All righty.
New evidence drinking a few extra cups could put you at a greater risk of some major health issues. Researchers wanted to look at the impact of coffee on blood pressure after exercise. Now, these are just preliminary findings from a small group of healthy people.
That's one for later. Sorry, guys.
Oh, okay.
All right, here we go. All right.
With energy and sports drinks and coffee drinks all the rage among teens, a new study finds the rate of kids visiting hospital emergency rooms for caffeine overdoses has skyrocketed. Rhiannon Alley explains why this is happening.
With energy and sports drinks and coffee drinks all the rage among teens, a new study finds the rate of kids visiting hospital ERs for caffeine overdoses has skyrocketed, more than doubling since 2017 among kids ages 11 and 14, and nearly doubling among older teens.
Even with all the warnings about side effects, kids and teens are still consuming caffeinated beverages.
ER visits among boys exceeding girls. The American Academy of Pediatrics recommends teens consume no more than 100 milligrams of caffeine per day. That's about 1 cup of coffee a day.
Most people, even adults who regularly consume caffeine, don't realize that some of those energy drinks that you can get in any store may contain 200 to 300 milligrams of caffeine in just one 12-ounce can. And guess what? Any kid can go into a store and buy one.
Symptoms of caffeine overload include anxiety, heart palpitations, and, in severe cases, heart attacks and even death.
When in doubt, take the can, turn it around, and look to see how many milligrams of caffeine are in that beverage, or go online and look it up. Before giving your child or teen any beverage, you should absolutely know what's in it.
Rhiannon Alley, ABC News.
All right. Yeah. So caffeine, yes, anyone can get it over the counter. And I'm saying that it's a drug because it is, but you don't really think about caffeine as a drug. So let's play my favorite little game, good people. Myth versus fact. Okay. So for my first question, everyone in the chat, myth versus fact. I want you to put an M1 if you think it's a myth, and then put an F1 if you think it's a fact. So myth versus fact. Energy drinks are just like coffee. Energy drinks are just like coffee. Put an M1 if that's a myth. Put an F1 if that's a fact. I have a couple more questions. Okay. The next question is, caffeine pretty much affects everyone the same. Caffeine pretty much affects everyone the same. For that one, put an M2 if that's a myth. Put an F2 if that's a fact. M2 for myth, F2 for fact. Caffeine pretty much affects everyone the same. And then the last question, oh, this feels like the SAT. The last question is, when you use natural sources of caffeine, that's always safer than using unnatural sources. When you use natural sources of caffeine, that's always safer. Put an M3 if that's a myth, F3 if that's a fact. Okay, put your pencils down. Okay, a quick review, and then we'll see what your answers are, and then we'll talk about it a little bit. So that first question was, energy drinks are the same as coffee. Okay, that was an M1 if it was a myth, F1 if it was a fact. The second one was caffeine pretty much affects everyone the same. That was an M2 if that was a fact, and M2 if that was a myth, F2 if that was a fact. And the last one is, when you use natural, holistic sources of caffeine, that's always going to be better than using unnatural sources. M3 if that's a myth, F3 if that's a fact. Yay, games. All right, anyone play my little caffeine game today?
Yes, several. I can't keep up. Dr.
Oh,
Frita.
yay. Okay, we're gonna start with this the M1s and the F1s for the first one. So energy
Okay.
drinks are just like caffeine. So let's see what M1s we have for who thinks is a myth, and what F1s we have who thinks that one is a fact.
All right, we'll go M1 first with the myths. We
So
say,
energy drinks are just like coffee. Yeah.
okay, so Nancy,
What did Nancy say?
M1 myth.
That's a myth. Okay, so she thinks there's a difference. Okay, who else do we have? Hi, Nancy.
Yakima, Yakima says myth.
Hi, Yakima. Okay, myth. All right.
And then we'll go with Angie says a myth.
Hi, Angie. So you say it's a myth. Does anyone think that it's a fact that, hey,
Yes.
it's a drink is a drink is a drink? Energy drink just like coffee.
Yeah, so the first few to chime in with fact.
All right.
Planet Life,
Okay, so you say energy drinks are just like coffee. Okay.
Althea,
Okay. Hi, Althea.
and Imelda.
Okay, so you're saying that it's a fact. And quite honestly, if I were a person writing standardized questions for the SAT or the PSAT or the GMAT or the LSAT, they probably wouldn't let me write the question, because this question actually does have a little bit of nuance depending on how you look at it. Okay, so energy drinks are just like coffee. Let's talk about it. So energy drinks do have caffeine, just like coffee has caffeine. And so if you think about it in the sense that some people might think that energy drinks are like pretty benign. I mean, they're colorful. They have these cans that look like soda cans. Kids can get them. Kids drink them. They might somehow think that energy drinks are safer than coffee, because most people think of coffee as more of an adult thing. But energy drinks are not necessarily safer than coffee. But most cups of coffee, although I will say it varies, coffee can have anywhere from 65 milligrams to 300 milligrams of coffee, depending on the strength of the bean, the brew, how it's brewed, how it's diluted, all those things. And so the amount of caffeine in coffee can vary, but on average, we tend to think that the average cup of coffee has about 100 milligrams of caffeine. Okay. When you look at energy drinks, however, those drinks are intended to have very high doses of caffeine. Okay. So the average energy drink is going to have much more than 100 milligrams of caffeine. Some of them can have 300 milligrams of caffeine. So in that regard, I will call it a myth. Energy drinks are not the same as coffee. Now, I can have some of my fact folks come in and say, hey, you said it yourself. Some cups of coffee do have 300 milligrams. That's true. But it's very rare. On average, the average cup of coffee has about 100 milligrams of caffeine, whereas energy drinks have much more. And so here's the other difference: marketing. Okay, when you look at commercials, you normally see adults, right, on commercials for coffee. You see a mom, you see someone at work, you see someone sitting, with a computer. Adults, right? Coffee tends to be marketed toward adults. With energy drinks, you usually see lots of color. You might see somebody skating on a skating board. You see things that are exciting, fun. You see kids playing sports or young adults playing sports. The marketing for energy drinks really seems to be toward younger populations. There are commercials that tend to attract teens. So it's the other thing with energy drinks and how they're different, the marketing of energy drinks. Either way, caffeine is caffeine is caffeine. And a big question is, how much caffeine is too much caffeine? All right. So there have been many, many, many studies. And truth be told, we have one new study that's coming out, but it's not super definitive. But for a good amount of the literature that we do have, it has been found in most studies that if you're drinking less than 400 milligrams of caffeine in 24 hours, most people, not all, tend to do okay. They don't tend to have all of the adverse effects. And there definitely are some adverse effects of caffeine. And I want y'all to go ahead and put in the chat for me, what do you think some of the adverse or bad side effects of caffeine might be? What do you think some of the side effects of caffeine might be? I want you to put that in the chat and we'll touch on it. But yeah, they say if you're drinking less than 400 milligrams, you don't get a lot of the severe side effects. But, that doesn't mean that caffeine affects everyone the exact same way. One thing that we do know, though, with these energy drinks, with teenagers, as they've talked about, we have more teens and middle schoolers showing up to the ER, because with these teenagers, especially if they're mixing energy drinks with alcohol or mixing the energy drinks with ADHD medicines like Ritalin, like Adderall, if they're mixing the ADHD even with some drugs, right? Like some ecstasy, some of the drugs we've talked about, that mixture of the caffeine, which an immature child might be more likely to do, can really cause a major, major problem. So even though caffeine is legal, even though it's over the counter, it's something that we need to watch, because in some people, it can cause a problem. They can have symptoms of an overdose, which leads them to the ER, like a lot of these middle school kids. So parents, make sure you talk to your kids. And even though they're able to go to whatever 5 and dime store, grocery store, corner market, and buy energy drinks, talk to your children about parameters and let them know about the amount of caffeine they should have. So we saw in the video, they said about 100 milligrams a day. More specifically, it's about 2.5 milligrams per kilogram per child. But yeah, about 100 milligrams per day is thought not to be very adverse, very bad for children. But for a lot of moms, you know your child, a lot of dads, you know your child, you might want to restrict them even more tightly. Okay, so the bottom line is that it's a myth. Energy drinks are not just like coffee, but I get your nuances for those of you who said fact. Caffeine is caffeine is caffeine. All right, for the myth versus fact number 2, caffeine affects everybody pretty much the same. M2 for who said it was a myth.
All right, so Catherine says the myth.
You say it's a myth. It might affect some people differently. And you might have witnessed it yourself. You drink a cup of coffee and somebody else next to you drinking it and they're over there shaking like a leaf. All right. So you say a myth. All right. Who else?
Veronica.
Hi, Veronica. You say that's a myth. All right.
And Carolyn.
Hi, Carolyn. All right. Did anyone say that was a fact, that it affects everyone the same?
Yeah, I had a couple of people say it was a fact. Sandra.
Okay. Hi, Sandra. Thank you for joining. Sandra, I love this game. I'm gonna tell you the truth. I don't know what my deal is. I just love these games. Okay.
And Kim.
Hi, Kim. You say it's a fact. All right.
Oh,
so that is who else?
Charlene.
Hi, Charlene. Also said it was a fact.
Yes.
That caffeine affects everyone the same. All right. So this one, there's not a whole lot of nuance because that one actually is a myth. Caffeine affects people differently. And if you think about it, even with your friend groups, if you're around people who drink caffeine, for some people, it can make them stay up all night long. Some people, like myself, could drink a cup of coffee before bed and good night, you still fall asleep. And then even though some people may have different effects for coffee, if ever you've been trying to be up studying all night and you take a caffeine pill, I forget the names of different pills, like no-dose, I don't know. I try, Shador. My study habits were not the best my freshman year of college. You know, I was just discovering my social life. And so early on, before I got my study habits down, I did a lot of last minute cramming. And I will never forget sitting up there at Florida State University in the Landis dorm, my little honors dorm. I was going to do an all-nighter for a test. And my roommate had a caffeine pill, and a lot of the kids were taking those. So I took a caffeine pill so I could stay up and study. When I tell you that I was literally having tremors and I was just shaky, jittery, and really got no effective studying done, that was the first and the last time that I took a caffeine pill. My roommate took them and she was sitting over there chilling and cool. So that is my firsthand story on how I know caffeine does not affect everyone the same. But before we get into some of the symptoms that I asked for, I do very briefly want to talk about the physiology on how caffeine works. I'll talk about that quickly and then we'll keep it moving. All right. So caffeine affects your adenosine receptors. We all have adenosine receptors. We have them on our brain, our heart, our kidneys. And when adenosine is bound to adenosine receptors, it makes you kind of chill, right? Kind of calm, slow heart rate. Hey, you're just kind of smooth with the adenosine. Well, what caffeine does, caffeine blocks adenosine receptors. And so when you have caffeine that's blocking those receptors, then instead of having the adenosine, which makes you kind of chill out, smooth, calm, you now, when the caffeine affects your brain, okay, when it blocks those adenosine receptors, it gives you wakefulness, right? It can make you wide awake. Which way did he go? Which way did he go, right? When the caffeine affects the adenosine receptors on your heart, instead of you having a nice, steady, slow heart rate, boom, you'll have a fast heart rate in a lot of cases, tachycardia, fast heart rate, okay? And when the adenosine receptors in the kidneys are affected by caffeine, you urinate a lot. Do you ever notice that when you drink a lot of caffeine, you're running to the restroom, urinating? Yeah, it's because the caffeine has attached to the adenosine receptors and it's increasing the urine you make. So that's the physiology behind caffeine works. It makes sense, right? As y'all listen, it's making sense when you think about how your body reacts. So now let me see, did anyone give us any symptoms of having a lot of caffeine?
Yes, of course. So we have diabetes mindful. Hello.
Hi.
Palpitation.
See, there you go. Palpitations. That goes right along with what we were just talking about, the adenosine receptors in the heart. Good. Yes.
Sandra chimed in with jitters.
That's it. Sandra, I'm trying to tell you, me on that caffeine pill, I was just like, yeah. So you can get jitteriness with the caffeine. Mm-hmm.
Kim says dehydration.
Hi, Kim. Kim, that's it. You're hitting the nail on the head. And now you see the physiology behind it. The adenosine receptors on the kidneys, increasing your urine output. So you can be drinking all the fluids you want, but if it's in the form of caffeine, it can dehydrate you. That's why my patients come in and they know I'm telling them how much water I want them to drink. And they'll be like, oh yeah, well, I drink a lot of that. I drink in coffee. No, the coffee with caffeine is dehydrating. That's exactly right. Thank you. All right. Anybody else? These are perfect symptoms. Yeah.
Yes. Swiss mocha. Hello.
Ooh, Swiss mocha. Mm-hmm. Hi.
Headaches.
Headaches. You can get headaches. And so that could be for a couple of things, right? It could be the effect of the adenosine, the caffeine on the adenosine receptors, right? Or you could be dehydrated and the dehydration can cause you a headache. Or if you're someone who is used to having caffeine every day and say you skip a day or two, caffeine withdrawal can be causing headaches, right? And then you drink a cup of caffeine and then that takes you back. In fact, let me talk about caffeine withdrawal real quickly. So when you drink caffeine every day, your adenosine receptors, have the caffeine. What happens is your body can start to get a tolerance. And so you make more adenosine receptors. Well, if you make more adenosine receptors, then the caffeine can't bind to all of them, which means adenosine itself will bind to the caffeine receptors and it'll make you kind of calm. Well, if you're drinking coffee to stay awake, you don't want to be calm. So whereas one cup may have kept you awake before, if you're developing intolerance, then now it might take 2 cups in order for the caffeine to hit all of those receptors, okay? But then if you go one day where you don't go into work or your local Starbucks, Dunkin' Donuts, whatever place is closed, then you don't have caffeine, well, then you can experience withdrawal symptoms, right? And that can cause headaches. All right, anyone else with the symptoms?
Yes, Planet Life.
Hi, Planet Life.
Seizure, heart arrhythmia, mood swings.
Now that will be extreme, but that takes us on to how the caffeine does not affect everyone the same. So yes, those are true. And that's going to be more with severe or high caffeine intake, probably more than the 400 milligrams a day. But especially if you're someone who already has an arrhythmia, like atrial fibrillation, okay? If you already have an arrhythmia, or if you have a sensitive heart, say you have a cardiomyopathy or congestive heart failure, then you could be at more risk of having an arrhythmia that's exacerbated by caffeine. And yes, the mood swings that can certainly occur, and you may have witnessed it. So very good. Now the seizure, that would be very extreme, but if you actually had a caffeine overdose, which is rare, then it's possible. And in order to have a caffeine overdose, by many studies, they say that it would take 10,000 milligrams of caffeine. 10,000 milligrams of caffeine. But remember, we said caffeine can affect people differently. So some people may hit that overdose realm at a lower dose. And then especially if you're doing the polypharmacy where you have the caffeine and alcohol, or caffeine and adrenaline, and caffeine and ecstasy, something like that, then you could start seeing something that's more severe, like a seizure. But excellent. Very good. All right. So then if we don't have any more symptoms, we'll move into the last myth versus factors real quickly, and then we'll roll on into our weekly dose.
Okay. Y'all know if you hit these. Elevated heart rate, says Sherry.
Definitely. Okay, good, Sherry.
Nervousness, says Nancy. Hey, Nancy.
Which that nervousness can kind of go into that jitteriness, right? Yes, I agree.
High blood pressure.
Boom. High blood pressure. High blood pressure can definitely be one. It can increase the blood pressure. So if you're someone who already has hypertension, you definitely want to consult with your physician on whether or not you should have any caffeine, or if your limit should be only 1 cup with 100 milligrams, if you should not dare go into 2 or 3 cups. Absolutely. Hypertension can potentially be a side effect. And Shador, with that, thank you. Let's go ahead and roll into another clip on caffeine. Then let's talk about some of the effects it can have with this new study that's out.
Buzz, Rebecca. Good morning to you guys. As you drink your morning cup of coffee, there is new evidence drinking a few extra cups could put you at a greater risk of some major health issues. Researchers wanted to look at the impact of coffee on blood pressure after exercise. Now, these are just preliminary findings from a small group of healthy people who did just 3 minutes of exercise. They found that those who said they regularly drank about 4 cups of coffee were more likely to have elevated heart rate and blood pressure after resting for 5 minutes. That is compared to those who consumed less caffeine. Now, researchers believe having too much could make people more susceptible to cardiovascular disease. But again, this is just preliminary data, so more research is needed. Until then, you can enjoy your coffee, guys, just maybe not too much.
Very good. Very good. So excellent point about the high blood pressure. And like she said, the data is not overwhelming. It's not overwhelming, but it certainly makes sense. And so for my patients who have very high blood pressure, I do recommend limiting their caffeine. All right. And for that last one, I don't know if many people weighed in on that last one, but natural sources of caffeine are always safer than unnatural sources. That's a myth. That's a myth. And we know caffeine actually originates from natural sources, right? And so it's still caffeine, it's still a drug. And so please don't think just because you're doing holistic or natural caffeine that it's better. It's a myth that the natural is always better. That's fun. Thank you, MedHeads, for joining us in that game. So now let's get into your weekly dose of medicine in the news. We'll continue to talk about the hot health topics in the headlines. The CDC, Shador, the CDC always has something to say. And now they are reporting that the amount of people with diabetes has doubled over the last 20 years. I'll tell you that is not a shocker to me because we already know that a lot of the causes of diabetes, yes, there can be genetic predisposition, but we also know eating a lot of processed foods, having sedentary lifestyle, being a person living with being overweight or living with obesity. All of these things are risk factors. And even looking at children, I don't know about y'all, but my kids sit up there. They're very active, thankfully, but video games. If you're not intentional about making your child encouraging your child to go out and exercise and be outside, those kids can sit at home and eat processed foods in front of the TV all day, be sedentary, which is why we have an increase also in young people. So yes, y'all be sure to go ahead, like this video and share it with people. Let YouTube know that we're here. We're giving evidence-based information that can be helpful in your everyday lives. Please go ahead and give us a like. It's a free way to support the channel. And when you do give us a like, if you also click share and you get that link, please share it in your group chats, put it in your chats, put it in your emails, put it on your Facebooks, your Instagrams, all of those things. And it allows people to know we're here. We get more folks to come and get some of this good old information. Thank you. Thank you. All right. So let's go ahead and play that clip, please, on what's going on with diabetes in the United States.
The number of adults with diabetes in the U.S. has more than doubled in the last 20 years. According to the CDC, about 37 million people have diabetes. 8.5 million are undiagnosed. 96 million adults have prediabetes. A 2021 study shows up to half of new diabetes cases in the U.S. are linked to obesity. Managing the disease is critical, as people with diabetes are twice as likely to have heart disease or stroke. Diabetes can also lead to health complications, such as chronic kidney disease, nerve damage, and problems with feet, oral health, vision, hearing, as well as mental health issues. But the CDC says patients can prevent or delay these complications and improve overall health by eating right, maintaining a healthy weight, staying active, and managing stress. When lifestyle changes are not enough to bring glucose levels to normal, medication may be necessary. Most people with diabetes have type 2. Type 1 diabetes is usually diagnosed in children and young adults. Gestational diabetes develops in pregnant women who have never had the disease.
Very good. All right, MedHeads, I want y'all to put in the chat some warning signs of diabetes, right? Some of the symptoms. So in that clip, they already talked about some of the complications. And for those of you who are new to the channel, I am Dr. Frita. I'm a board certified kidney and high blood pressure specialist. And I will say that the number one cause of kidney failure in this country, in the United States, is diabetes. Okay. It's the number one cause of kidney failure. The number two cause is high blood pressure. But beyond causing kidney failure, as was mentioned, diabetes can cause blindness. It can cause diabetic retinopathy. Okay, so you can get blindness. You can certainly get poor circulation, which can lead to amputations. Okay, poor wound healing. heart disease. It puts you at risk for heart attacks, strokes. It's not nice. Okay. So make sure that you see your doctor regularly and you have your hemoglobin A1C checked. The hemoglobin A1C lets you know if you have diabetes versus pre-diabetes versus if you're in a safe role. So what is the hemoglobin A1C? Well, we know that you get your blood sugar tested, right? Like when you get your basic metabolic panel or that BMP, there's a glucose on there or blood sugar. And I know I'll have patients come in and oh yeah, my sugar was high. I had a donut for breakfast. That's why. But the hemoglobin A1C gives us an average on what your blood sugar has been running over the last 3 months. Okay. So it's not a snapshot. It gives us a good average over the last 3 months. And if your hemoglobin A1C, so those of you who have your labs in front of you, or if you have access to your My Chart, if your hemoglobin A1C is between 5.7 and 6.4, you have pre-diabetes, okay? Pre-diabetes, and it's time to make some lifestyle changes, okay? Be it making sure you have a healthy weight, eating less carbs, doing more exercise. Consult with your physician. And if you've been to your doctor and you have not been told what your hemoglobin A1C is, call, ask, request, because it's certainly a wonderful screening tool that can help prevent you from actually getting diabetes, okay? So it's pre-diabetes if the hemoglobin A1C is between 5.7 and 6.4. Okay. And if you want to know more about really the physiology and what diabetes is, make sure you check out my videos on diabetes right here on this YouTube channel. And I'm real proud of us here on the Dr. Frita YouTube channel because we have over 800,000 subscribers. Over 800,000 subscribers. So we're on the road to 1 million. So if you have not subscribed already, please be sure to subscribe and hit that notification button so you'll be among the first to know when we release new content. I released a new video last week that's pretty cool. I'm talking about some carrot ginger juice. And oh my gosh, I had my daddy try the juice. Why did I have him do that? I didn't even edit it out, his response. But anyway, I like it. The juice is good to me and it's definitely healthy. Anyway, did anyone put any symptoms of diabetes in the chat, Shador?
Absolutely.
Okay.
A little rundown. Randy, hello.
Hi, Randy.
Extremely thirsty.
That's right. If you have high blood sugar and that sugar actually accumulates in your bladder, it can draw in more water, right? And that can make you have polyuria or urinate frequently. And so if you're having polyuria because of the high blood sugar, getting rid of all your urine, you dehydrate yourself, you can be thirsty. That's great. That's right.
Sandra says numbness and tingling in the hands and feet.
Very good. So the diabetes can cause you to have a peripheral neuropathy, right? You can get diabetic neuropathy. So the high blood sugars can affect your nerves, and oftentimes it's pronounced in your fingers, in your toes, in those distal nerves. And so, yes, you can get tingling in the hands and the feet. And that's why it's important for people who have diabetes, consult with your doctors, consult with your endocrinologist, because there are special diabetic shoes made. It is not recommended that you walk around being barefoot because you might have some numbness, some tingling, where you can step on something and not even realize that you stepped on a splinter or something like that. And then it can move on to becoming a pretty severe infection, maybe even requiring you to have an amputation, because if you don't feel it, plus you have poor wound healing from poorly controlled diabetes, then that can be a problem. So that's a good point. Yes.
Yeah. Marcia, hi.
Hi,
Says weight
Marcia.
loss.
Unintentional weight loss. That's very, very good. So with the diabetes, even though that blood sugar is high in the sky, with diabetes, your cells are not getting the proper use of that blood sugar. And so your body is actually in a starvation mode. And if you look at my videos on Diabetes Explained, I go into details on what that is. And if we have time at the end, I might go back and go into some detail, but absolutely. And so you can have an unintentional weight loss if you have high blood sugars and uncontrolled diabetes. That's a very good one. Yes. Yeah. All right.
Dry mouth and brain fog.
Yep, you can get dry mouth again from being dehydrated, and then certainly you can get some confusion, especially with hyperglycemia. These are good. See, that's why I love. I love y'all in the chat. I appreciate your participation, and y'all, you have excellent knowledge, excellent health knowledge. All right, so we will keep on moving unless you have a couple more to throw out there, and we'll move on to our next topic.
Yeah, Fran threw out a couple.
Okay, hi, Fran.
Clammy skin and sweet smelling breath.
Ooh, so if you go into that diabetic ketoacidosis, you can get a sweet smelling breath. That is true. And what was that first one?
Clammy skin.
Yeah, you can get like a diaphoresis or a clammy skin. So this is what we're talking about here is like if it's a poorly controlled diabetes, or if you have the hyperglycemia. That is very true. That's true. And yeah, and diabetes is quite common. As mentioned, that 37 million Americans have diabetes. Most have type 2 diabetes. Okay. So over 90% have type 2, and a smaller percentage have type 1. Oh gosh. I'll just say real quickly, as far as the difference, I go into more detail in the videos, but if you think about insulin is like the key that unlocks your cell. Okay. And each cell needs to have blood sugar. Okay. In order to have energy. Well, in type 1 diabetes, you don't make enough keys. Okay. Your pancreas does not make enough insulin. You don't have enough keys. Therefore, the blood sugar cannot get into the cells because they don't have the key to unlock the cell. So you get a lot of blood sugar around the cells, but because you don't have enough keys, the insulin, you get hyperglycemia or diabetes. In type 2 diabetes, you have the keys. You have plenty of insulin, but the keys don't work. Okay. You have insulin resistance. Okay. In type 2 diabetes. So you might have a lot of insulin in your body, but it's a bunch of keys that don't work. So the end result is you still have high blood sugar, but it's not in the cell. So you're not getting efficient energy. So that's the basic 101 difference between type 2 and type 1 diabetes. All right. So speaking of diabetes, we have a lot of celebrities who've had diabetes, who've been open and shared. Tracy Morgan, the comedian and the actor Tracy Morgan, he had diabetes and ended up having kidney failure from the diabetes. He now has a kidney transplant. And we also know that Larry King, now he was a lean and slim. We know he's passed away. He had diabetes as well. And then Patti LaBelle has been open about her journey with diabetes. But we have someone else who has diabetes, who had diabetes, and it's Quincy Jones. And I do just want to talk about Quincy Jones and recognize him for the legendary musical genius that he was. But we know he passed away at the age of 91, and he was dealing with diabetes among other health issues. So let's roll this clip on diabetes. On Quincy Jones.
Okay.
Just get up every morning and love what you're doing.
6 years in the business, what's your highlight? What do you want?
How do you choose between Sinatra, Ray Charles, Aretha, Michael Jackson, Shaka Khan, and 50 Cent?
Quincy Jones was the ultimate music producer.
I like to make a record I'd like to hear.
He's just the best that there ever was in his field.
I've been in entertainment since I was 12 years old, so all you can do is just reach for those instincts and leave some room for God to walk through.
He won 28 Grammys, 3 for We Are the World in 1986.
Well, Stevie, Michael, and Lionel over here, so we're just getting ready to cut the track.
The hit song featured 46 of music's biggest stars.
It's true we make a brighter day, just you and me, instead of better. Everybody say brighter, because that's what they're saying anyway.
We Are the World went on to become the biggest selling single in both U.S. and pop music history.
It was a fun session. It's hard enough with one singer. Think about 46. I think we had some divine help there that night.
Quincy's start as a teenager, playing the trumpet.
I've been blessed since I was 19 years old. I got a chance to travel with Lionel Hampton's band. Count Basie adopted me at 13. I came up with Ray Charles when I was 14. He was 2 years older, but he seemed like he was 100 years older.
Quincy's legendary musical influence paved a path to success. Over his 7-decade career, he composed more than 50 film and TV scores.
Yeah, it goes on and on and on. And I didn't even realize all of his accolades, Shador. He even helped to discover Oprah Winfrey as an actor because he was a composer and involved in production with Color Purple. Okay. And so Oprah Winfrey, he thought that she would be perfect for the role, Sophia. And we know that she was. Mm-hmm. And if any of you watched The View and you saw Whoopi Goldberg, who, played Celie in the original Color Purple, she said that she and Quincy Jones were so tight that he was her rock in many ways as far as encouraging her through the years. We know about Michael Jackson. He was his albums, Off the Wall, Thriller, oh my gosh, Bad, all Quincy Jones. And then one thing I didn't know, Shador, that Austin Powers music, that iconic Austin Powers music, composed by Quincy Jones. So his talent was pure genius and far-reaching, far-stretching. And so, he passed away at the age of 91. And I just don't think we're going to have another Quincy Jones. But for the purposes of today, medicine in the news, I did share that Quincy Jones lived with diabetes, and he also lived with a few other things. He had suffered with strokes. Okay. And we know that strokes are actually quite common, and there are different risk factors for stroke. Certainly, if you have high blood pressure, that puts you at risk for a stroke, high cholesterol, sedentary lifestyle. And there are two main categories of strokes. Okay. You have the ischemic stroke, which is when your vessels, a brain vessel, is not getting enough blood. Okay. So perhaps if you have a plaque, an atherosclerotic plaque or cholesterol blocking, a part of the brain may not be getting enough blood flow, that can cause a stroke. Or if you have a hemorrhagic stroke, when, like, for example, if you have very, very high blood pressure and you get bleeding blood vessels or bursting blood vessels, then that can give you a hemorrhagic stroke. The ischemic stroke is more common. About 87% of strokes are ischemic, whereas about 13% of strokes are hemorrhagic. And for the ischemic stroke, those can actually be broken up into two categories as well. You can have a thrombotic stroke or you can have an embolic stroke. So basically, a thrombotic stroke, you can basically have like a thrombus or a clot that's just sitting there. Like, say you have a plaque there and then some platelets come by and they stick to it. That can cause an issue, can cause a stroke. Or you can have an embolic stroke, which is when a clot goes from somewhere else and it gets up into the brain. Any of my med heads, since y'all know all the answers today, can y'all think of any sources that could give a person an embolic stroke, meaning a clot comes from somewhere else in the body and then ends up in the brain, causing a stroke, an embolic stroke? So I'll get back to that if anyone answers that question. All right, but let's just roll the rest of this clip where they touch on briefly about Quincy Jones, some of the medical issues that he has.
Quincy was always learning. His health issues taught him to make the most of every moment. In 1974, he underwent brain surgery twice for aneurysms.
The nature's way of getting your attention, to make you live your life, really live it.
I asked the doctor afterwards, what is that process, what was going on at that time? And he said, you were dying, I had to try to rehabilitate, and I could go through therapy to be able to write, because it's frightening to see, those big jagged edges, when you're trying to write again. And dropouts in memory. So that's scary. That's frightening. I mean, people real close to you, and it just disappears.
And in 2015, Quincy suffered a stroke that left him in a diabetic coma.
See, and I didn't even realize all those things about him, Shador. I guess, when those things were going on, he was kind of out of the limelight, and it looks like the media just kind of respected his privacy, which I know the media doesn't do very much. But for us, that when we're talking about it, we're just trying to learn so we can live our healthiest, happiest lives. Make sure you like. Don't forget to give us a thumbs up, please, and share this video. And if you want to learn more about strokes, good folks in the chat, then I do have a video right here on the Dr. Frita channel on Strokes Explained, where I go into detail. And as far as one of the risk factors I discussed, cholesterol, I have another video right here on this channel on how to unclog your arteries naturally. Okay. Did anyone say anything about what they think might be a source of an embolic stroke?
Yes, Althea chimed in. She says, I think constipation.
Okay, so I know what you're talking about. If you have a Valsalva maneuver, so if you're straining, and there are different things that can occur, because you oftentimes hear people who fall out or like pass out while using the restroom or have a situation. But actually, as far as the source for the embolism, I'm looking for a different answer. But yeah, you're talking about Valsalving and straining causing certain issues. Okay.
T Chosen says AFib.
That's it. That's the answer I'm looking for. T Chosen 1. See, T Chosen 1. So yes, if you're someone who has AFib or atrial fibrillation, that's one of those abnormal heart rhythms where we already said that, having an abnormal heart rhythm, caffeine could hit you a different way. Well, as far as strokes are concerned, if you have atrial fibrillation, and that means that your atria, two of those chambers in your heart, are just contracting, and instead of blood flowing along and being pumped the way it's supposed to be pumped, it might actually cause the blood to slosh around and you can form a clot in the heart. Well, if you have a clot in the heart, and then on top of that, you have some type of a defect, like a hole in your heart, then that clot can cross over. It can head into one of the arteries that leads it to your brain. So having atrial fibrillation is a risk factor for strokes. And we know that Senator Fetterman in Pennsylvania actually had a stroke even, before becoming the senator. And it was believed to be from the source of atrial fibrillation that he was diagnosed with. That's it. Okay, very good, very good. There's another source also. Did anyone else chime in?
Yes, Veronica.
Hi, Veronica. What'd you say, Veronica?
PE.
A pulmonary embolism. So that's a little different from a stroke, but it is an embolism, just like you're saying. So the other source for a stroke is going to be in the carotid artery, these neck arteries. If you have like a plaque, cholesterol plaque, atherosclerosis in the neck, you might notice that your doctors will sometimes listen to your neck arteries. What they're listening for is to see if they hear a sound that lets them know there's a narrowing or a blockage. And if so, then they'll oftentimes have you to go get carotid Dopplers or maybe even MRAs of the neck, because they want to find out if you have a clot that is at risk for breaking off and going to your brain. So some of the common sources for the embolic stroke: atrial fibrillation, if you get a clot in the heart, or a carotid. Now let's talk about pulmonary embolism, because as you see, the word embolism is in there. So with pulmonary emboli, oftentimes you'll have blood clots in the body, in the veins, like a deep venous thrombosis, maybe a clot in your lower leg, a clot that's right behind the knee. And when that clot breaks off, then it can go to your lung. Okay, so it doesn't end up in the brain, but to your lung, causing you to have pulmonary emboli. It can cause you to have shortness of breath. Or if on the way to the lung, it gets caught in some of the major vessels in the heart, okay, somewhere between the heart and the lung, like a saddle pulmonary embolus, it can even cause you not to be alive. So it is an embolism, but the pulmonary embolism is going to the heart. And what I was talking about for the strokes are the ones going to the brain. But that's good. You know what? Make sure you check out my video on this Dr. Frita channel. I have, if you look up Dr. Frita blood clots or Dr. Frita pulmonary emboli, you'll see where I go into details about that. I love it when y'all participate. I love this very much. All right. And for those of you who have questions and say you have, more questions, we're going to hit a Q&A at the end. But if you have more time, if you want to spend more time, then make sure you join our membership. We've had a couple live Q&As now. We do monthly live Q&As that are for members only. So that way I just have a small amount of people, and for the entire session, we're going back and forth. You do follow-up questions. We have a very good time. Click the link in the description to join the members. I also have videos. There's one that I'll probably be releasing today because I talked about my week. I told you I was a patient last week and I had an attitude. So I talked and gave some details on some of the stuff I went through last week. That's on a members only video. So for my members who are here, let's shout out the members who are here. Check that video out. Just make sure you look at your notifications. It'll let you know. And also, if you're a member, you get fun stuff, loyalty badges, things of that nature. But the main thing is that live Q&A where we have an intimate discussion. We go back and forth. Now, if you want a more personable discussion, like if you have some medical problems that you definitely want to be kept private, then I do have a telehealth concierge service available. Click the link in the description. With that, you'll be able to have a session where it's one-on-one. HIPAA will be in effect in that session. Here, y'all know this is public, so whatever y'all say right here is public on YouTube. And members only, yes, it's just the members, but for the people who are members you don't know, they can still hear your information in the members only live Q&A. If you need confidential information and really just my undivided attention, then make sure you do this telehealth service. And a reminder, I mentioned that I'm board certified in nephrology and hypertension, but I also have had board certifications in internal medicine, pediatrics, as well as obesity medicine. And so I take great pride in what I do as far as giving you evidence-based information. And so if you set up this one-on-one concierge service, then I will be able to help you with your medical problems, give you a second opinion, first opinion, however you want to do it. All right. Good. All right. So that is the deal on that. But yeah, so he had the stroke, he's had diabetes, and he's also had aneurysms, okay? Aneurysms, but he's not the only one. There's a 38-year-old mother who had an aneurysm, which really could have taken her life. Let's roll that clip, Shador.
One mother's miraculous survival from a brain aneurysm. Ariel Reshef is here with her story and the warning signs we should all know. Good morning,
We
Ariel.
all need to know this. Good morning to you guys. And miraculous is the perfect word for this story. Julianne suffered a massive brain aneurysm at just 38 years old. Her 10-year-old daughter sprang into action, which likely saved her life. Now the young mom wants to pay her miracle forward by making sure everyone knows the signs.
You could call it beating the odds, but Julianne Smith believes surviving and recovering after a massive brain aneurysm rupture didn't happen by chance.
The fact that I'm even here is an absolute miracle, and The power of prayer is so real.
Last January, the busy mom of 3 passed out in her kitchen. Her panicked 10-year-old called dad at work, who called 911.
So I show up, and Julianne's like, I just don't feel good. I'm really dizzy. And then she puts her hand on her head and just lets out this horrible scream.
Julianne, just 38, was life-flighted to the Cleveland Clinic. Doctors say only about 30% of patients with as severe a case make it through without significant disability.
We never like to see patients come in that severe condition. She was on the brink of death.
Julianne underwent emergency surgery and was put into a medically induced coma for 14 days. Then another high-risk surgery prevented a massive stroke, but eventually she came to.
We were actually astounded. She was following commands. She was talking, like interacting with her family. It was truly miraculous.
Experts say about 30,000 patients in the U.S. suffer a brain aneurysm rupture each year. Some signs to look out for: sudden severe headache, nausea, stiff neck, confusion, blurred or double vision, loss of consciousness. For Julianne, recovery was an uphill climb.
Now right step, Julianne. Yeah, good job.
Learning how to walk again, speech and physical therapy. But though it was grueling, she says she was driven by purpose.
I looked at the therapist and I said, I have a lot to live for.
She returned home on Valentine's Day, and now, just 9 months later,
I don't see any fluid in there, so that's good.
even her doctors are amazed by her progress.
That is amazing because Shador, a good number of people, as they talked about, who get aneurysms like that, they don't make it. And so they already covered, some of the signs of an aneurysm or the symptoms you might have as far as stiff neck, severe headache. And really what an aneurysm is, it's just it's like a bulging of an artery wall. So you get this bulging thin artery wall. And so of course it becomes sensitive. And if it ruptures, then it can be catastrophic. So if you already have an aneurysm and then you have very high blood pressure, you can get a rupture, which can end your life. And I remember I first learned about an aneurysm when I was a young child in St. Petersburg, Florida. And we had a director of our community center, so she was over the community center at Lake Vista. And so of course at summer camp, those kids got on my nerves at summer camp, and I could not stand the lunch. We had these little plastic covered sandwiches and little milk cartons. I was always hungry after lunch. But anyway, Miss Green was extremely nice. And she was a young lady, and she was a beautiful lady. And she was gone. She lost her life. And that's when I first heard that word. I was a young girl, aneurysm. She had a brain aneurysm. So make sure you pay attention to your bodies. It's not one of those things that we screen for routinely, aneurysms, but anytime you're getting a severe headache, say your blood pressure's up and it's not your baseline, stiff neck, all of those things, don't just ignore it. Don't just poo-poo it away and say, oh, I'm just going to take a Tylenol and maybe it'll go away. Call 911. Okay, call 911. And I'll tell you, Shador, this story also reminds me of something we covered briefly last week. We talked about Megan Thee Stallion in her words and how she did a documentary. Mm-hmm. Well, I watched that documentary this past weekend. Phenomenal. It is phenomenal. And one of the things Megan Thee Stallion talks about is how her mother passed away with a brain tumor. And this is when Megan was only 24 years old. It just happened 2019. But, she talked about her mom and what she describes as a medically induced coma and things of that nature. Make sure, give me a follow on Instagram at dr.frita, because today I'm going to post a video that I do talking about brain tumors, warning signs of brain tumors. Again, it's something that we don't screen for, but certainly if you know the warning signs and symptoms, it gives you that much more of a chance of being able to catch it in yourself or in a loved one. So yeah, follow me on Instagram at dr.frita.com, put your notifications on. And today I'll release my video on some of the medical messages in Megan Thee Stallion's In Her Words. All right. So no, we don't have screening for aneurysms, not routine. We don't have screenings for brain tumors, not routine. We do have screenings for colon cancer though, Shador. And one of the stars of the show, Dawson Creek, shares that he was diagnosed with colon cancer. Let's roll some of that clip, Shador.
James Van Der Beek revealing that he has colorectal cancer. The 47-year-old actor writing in a statement, "I've been privately dealing with this diagnosis and have been taking steps to resolve it with the support of my incredible family." Van Der Beek also posting on Instagram late Sunday saying, "I'm in a good place and feeling strong. It's been quite the initiation, and I'll tell you more when I'm ready." Van Der Beek also apologizing to those in his life who didn't know he was battling the cancer, saying he was forced to announce his diagnosis after he was informed that a tabloid was going to run with the news, writing, "Nothing about this process has occurred on my preferred timeline, but we roll with it, taking each surprise as a signpost pointing us toward a greater destiny than we would have discovered without divine intervention."
Yeah, so Van Der Beek with colon cancer, and it looks like he got diagnosed at an early age. He apologized to those who didn't know that he had it, but honestly, we come here and we talk about the news that makes the headlines, things of that nature, but he actually does not owe anyone an explanation, so no apology was needed, right? Right? But since it is out, and since he has explained it, you know what we do here with these headlines that folks are watching and reading about. We give the information and the education. So yes, colon cancer is something that we actually do have screening for. According to the American Cancer Society, it's recommended that people with average risk get screened by age 45. And there are different societies that have different recommendations. Consult with your doctor. And the gold standard screening is a colonoscopy. Now, if you have a first degree relative who's had colon cancer, then the recommendation for you may be getting screened 10 years before that person was diagnosed. Consult with your doctor. So for example, if you have a father who had colon cancer and he was diagnosed at the age of 40, then it may be recommended for you to be screened by the age of 30 with a colonoscopy. All right. And then if you have two first degree relatives of any age who had colon cancer, then that screening is typically recommended to be done earlier for you. And so there's different screenings. There's DNA tests, colonoscopies, sigmoidoscopies, which are not the gold standard. Typically for colon cancer, if you're at average risk and you don't have any abnormalities, no polyps, then they'll recommend the colonoscopies every 10 years, sigmoidoscopies every 5 years. Personal point of preference, that sigmoidoscopy does not look at the whole colon, right? It only just looks at just one side, like the left side of the colon. And so that is not the gold standard. That's not anything that I would recommend. The colonoscopy looks at the whole colon. Again, what I give here is information. It does not replace the advice of your physician, but just if your physician is recommending a sigmoidoscopy, recognize the difference. It's not looking at your whole colon. So I would advocate for myself and request a colonoscopy. Consult with your doctor, but take that knowledge with you, please. All right. For more information on colon cancer, I have a video right here. And let me just ask real quickly before we slide into our last video and just a couple of questions. Does anyone know which reality show star lost her husband to colon cancer? And they were very public about this. Which reality TV show star lost her husband to colon cancer? And while y'all are putting that, we'll share some of the people we know, because I know y'all know about Black Panther, Chadwick Boseman, who lost his life to colon cancer. And he kept us out of his business. We didn't find out until he was gone that he was even sick, right? In hindsight, you might look at some of the last movies that he did where he was very, very thin. I thought he was just doing like the method acting and getting into the role of being very thin. But apparently he had been sick for a while. We lost him. And then for those of you who know Katie Couric, we talked about Katie Couric because she shared pretty recently that she had a diagnosis of breast cancer. It was found early, so her prognosis is great. But years ago, Katie Couric lost her husband at the age of 42 to colon cancer. Okay, she lost her husband at the age of her husband to colon cancer at the age of 42. And oh yeah, and when I was talking about risk factors, in addition to being at high risk, if you have first degree relatives who have cancer, like colon cancer. Also, if you have some genetic syndrome like FAP, familial adenomatous polyposis, if you have multiple polyps in your kidneys and that's something that you're genetically predisposed to, then certainly you'll have a more frequent colon cancer screening. Or if you have certain inflammatory bowel disease like ulcerative colitis, for example, that puts you at a higher risk for colon cancer. And so you'll have more intensive colon cancer screenings. Shador, did anyone know which reality TV star lost her husband to colon cancer?
Yes, so a few chimed in by our very own members only, Miss Kim Luder.
Hi, Miss Kim. That's my member. Look for that video. It's probably going to be today that I release it. My week was a mess. It was a mess, okay? And I look a mess in the video, but don't worry about that. All right. So what did she say?
Nene Leakes.
That's right. Nene Leakes lost her husband, Greg. And for those of you who have been Real Housewives of Atlanta fans like myself from back in the day, and y'all can kind of tell I am because we talked about her youngest son, Brent, who had the heart transplant. If you missed that after you finish watching this video, you can catch it in the replay. A couple of weeks ago, we talked about Nene Leak's son, who had the heart transplant just recently at the age of 25. Well, prior to that, she lost her husband, Greg Leaks, who was on the show from the very beginning. I love me some Greg. I do. He was very open, and he shared that he was not getting his colon cancer screenings, which brought up a big barrier for many males. They feel like their masculinity or their manhood is being challenged from having a colonoscopy, because of course, you know where the scope has to go. The camera has to go in through the anus, through the rectum, which of course that's just for your health. But there's a lot of toxic masculinity. That's just the reality, where men don't want prostate exams done. A lot of men don't want colonoscopies. Not all. I don't want to overgeneralize, but Greg Leaks was very open about that. And then even once he was diagnosed, part of their treatment plan included, I believe, some chemotherapy and some follow-up. And I know at least initially, he shared that he was resistant. He wanted to go just the holistic route. And so initially he didn't take all of that Western medicine. I'm not sure what he did in the end, but initially he rejected it. And, you know, time is of the essence. So if you make decisions where you reject something, you have to make sure you understand all of the risks and the benefits. But I appreciated him for sharing his journey and being honest about sharing that getting screened was not on the top of his agenda. So yeah, so make sure you watch my video right here on the Dr. Frita channel. And if you're not a subscriber, come join the over 800,000 people who are subscribing. We're having a good time over here. But yeah, Dr. Frita, colon cancer explained. I go into more details, and I talk about Greg Leaks on that video because I did that video back really soon after he passed away, and it kind of messed me up. It shook me up. So yeah, he inspired that colon cancer video that I did. All right. So then we'll just very, very briefly hit on this last topic, do a couple of Q&As. And remember, for those of you who actually want to spend a whole time doing Q&A, where it's not just me yapping, but you get to ask me questions, click that link like Kim did and join us for our members only lives. We do them once a month, but even throughout the weeks, throughout the months, I give you members only videos that no one else will have access to. And you get first look at a lot of the videos that I will release to the general channel. I'll give you the first look on the members only channel. Come on, we're having some fun. And don't worry, if you don't join the members only, I'm still going to give you these lives. I'm still giving you the evidence-based content that you love, but you get a little bit more sauce on it. You get a little more icing on the cake, a little bit of the VIP perks if you join the members only. And y'all make sure you click that like before we get out of here. And for those of you who are watching us in replay, please hit the like and share. We appreciate you. All right, let's roll our last clip, do a couple of questions and slide on out.
That just 5 extra minutes of exercise may help lower blood pressure. Good news for nearly half of all Americans who have high blood pressure. That's according to the CDC. Our medical correspondent, Dr. Darren Sutton, is here with more. So break down this study for us.
Some motivation, just 5 more minutes. I know if anyone's like me, that 5-minute mark comes up and I'm already off the treadmill and in my bed. But this is some motivation to keep that moving. It's a new study published from Circulation. It looks at over 15,000 participants, and it found that just 5 additional minutes of vigorous exercise was associated with a drop in blood pressure. Now, Robin, that drop was only about a half a point, but as you know, small drops make an ocean. It further found that bigger investments yield better returns. It compared just sitting for 30 minutes, for example, watching television. Instead, getting out and moving for 20 to 30 minutes, physical activity, that was associated with a blood pressure drop, so much so that it reduced the risk of chronic disease. We're talking about reducing the risk of heart disease, reducing the risk of stroke, which is why these findings are consistent with what we know from the American Heart Association recommendations.
This is so promising. And we want to emphasize this is an additional 5 minutes to your already the routine.
Additional vigorous 5 minutes.
Vigorous 5 minutes, which is why that's important.
I'm glad you said that, Mike. What qualifies as vigorous, intensive exercise?
I'm glad you said that. So vigorous exercise is getting your heart rate up, making you breathless, just the point where you start to sweat. That's when you want to get that workout in, or that's when it qualifies as vigorous. Everything else can be moderate or mild. So you got to get that heart rate up.
Well, Michael makes me breathless and makes me sweat.
Oh, y'all didn't mean to laugh out loud. That was good. Oh my gosh. So yeah, so y'all know we're always on this channel talking about exercise. It's really neat. I love when different data points come up to support what we already know. Make sure that after you finish watching this video, you check out my video right here on this YouTube channel, Dr. Frita, on the 10 best exercises to lower your blood pressure the natural way. Make sure you check those out. So, and I noticed, he was doing in the video, they were doing some of the planks and the isometric exercises because we know those are very effective. All right, Shadora, we have a couple little questions we can slide on in before we get out of here. As y'all hit those likes, hit those likes, hit those likes. And speaking of lowering blood pressure, make sure that you can click the link in the description, or you can go to Amazon to get my book, Under Pressure, A Guide to Controlling High Blood Pressure. So not only do I talk about medicine, of course I talk about medicine, I use medicine, but I also talk about lowering your blood pressure using holistic measures, using food as medicine, exercise, breathing, mindfulness, lifestyle. Okay. Because if you can lower your blood pressure the natural way, then you may be able to avoid medications or at least be on a minimal dose. Okay. So make sure you click the link in the description. Or if you go to dr.frita.com, that's your one-stop shop. Okay. It gives you my favorite things. It gives you the videos. It gives you the book, all the things. All right, Shadora, what do we have? Any questions? Any takers?
All right, so I asked a couple of questions, Dr. Frita.
Okay.
We'll start with Bern. Hello.
Hi.
What kind of symptoms you might have if you have AFib?
Oh, very good. So if you have atrial fibrillation, we know that's an abnormal heart rhythm where the heart is beating at an irregular beat. And it's because those, you have your 4 chambers of your heart. You have the atria up top, the 2 atria, and the 2 ventricles. Well, the atria have abnormal beats. Instead of the heart going boom, 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 between 60 to 100 beats per minute. In atrial fibrillation, it sounds more like boop, 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 erratic. So the symptoms may include feeling that abnormal heartbeat. You might feel like heart palpitations or fluttering in your chest. You might get chest pain. Another symptom could be lightheadedness, okay? Because if you're having atrial fibrillation and a very, very fast heart rate, you might not be getting proper perfusion to your brain, proper blood flow to your brain. And so those are some of the main symptoms, okay? So heart palpitations, the fluttering, chest pain, lightheadedness, dizziness, fatigue, weakness. If you're suspicious, make sure you report to your doctor right away. And if you're having those symptoms, certainly chest pain, then you'll want to activate EMS, emergency medical system, or call 911. What they'll do when you get there is they'll do an EKG or some type of a heart tracing. And with that, they can diagnose how that heart rhythm is if you have atrial fibrillation. And they may check out some other things like do an echocardiogram, which the same way that pregnant women get sonograms or ultrasounds of their belly, an echocardiogram is a sonogram of the heart. And that lets them see the heart size, if there's any kind of a valve issue, like if you have valvular heart disease, that lets them check that out. And, then they'll consult a cardiologist and give you a treatment. They might give you a treatment like a medicine that's a beta blocker, something like a carvedilol or metoprolol, or depending on how, serious the atrial fibrillation is, they might have to do something to reverse or convert you to a normal rhythm right then and there. But yes, if you're having symptoms, if you're suspicious, make sure you see your doctor. More likely than not, they'll put you on a blood thinner as well, because as we mentioned, atrial fibrillation puts you at risk for having blood clots in the heart. And we certainly don't want those blood clots to go through a hole in the heart or through a defect in the heart, and then you end up with a stroke. So I hope that answered your question. Thank you.
All right, thank you. Next question comes from Sudhir. Hope I'm saying it correctly. If not, I do apologize.
Spell Sudhir.
Sudhir.
Okay, Sudhir. Oh, I like it. Hi, Sudhir.
If A1C is 6.1, do you need medication?
It depends. So as we mentioned, a hemoglobin A1C between 5.7 and 6.4 does mean that you have pre-diabetes. You don't have diabetes, you have pre-diabetes. And so, of course, what I give you is information. It does not replace the advice of your physician. But what most physicians will do with that 6.1 is they will give you some lifestyle changes. So if you're someone who's living with being overweight, meaning your BMI is 25 or higher, or if you are living with being obese, okay, if you have a BMI that's 30, okay, then they will likely recommend that you lose some weight, that you get to a healthy weight, especially if you have a lot of abdominal fat, okay, belly fat, abdominal adiposity, because if you have an abdomen that's pretty large, especially if your hips aren't that big, the waist to hip ratio is large, then we know that having a lot of belly fat, okay, abdominal adipose tissue can decrease your insulin sensitivity and put you at risk for diabetes and pre-diabetes. So your doctor will recommend that you're at a healthy weight. If you're already at a healthy weight, they'll recommend that in addition to that, that you exercise. According to the American Heart Association, it's recommended that most people exercise 150 minutes per week. So that's about 30 minutes per day, 5 days a week. So they'll likely make that recommendation. Also, your carbohydrates. We know that if you have a diet that's high in carbohydrates, that's high in prepackaged foods, foods with preservatives, things of that nature, we know that those types of diets put you at risk for diabetes and prediabetes. So your doctor will likely recommend that you have mostly a plant-based diet with lean proteins, things of that nature. So the exercise, the diet, all of those things. So with 6.1, again, you don't have diabetes, but that's that little warning that you could get it. And so your doctor will likely recommend lifestyle adjustments first. That being said, we do have studies that show us that certain medications can help you to have a greater insulin sensitivity. So it's possible that even though you don't have diabetes, your doctor may recommend a medication like metformin, which can make your body more sensitive to your insulin. And it can go ahead and, in addition to the other lifestyle changes, help to get you to a healthier hemoglobin A1C. And your doctor, especially if you're someone who's living with being overweight or living with obesity, your doctor might recommend one of these GLP-1 agonists like the Ozempic, the Wegovy, the Mounjaro, the Zepbound. Your doctor may recommend that, even though you don't have diabetes. So the short answer is that having a 6.1 does not mean, boom, it's time to start medications, but it is possible that your doctor may recommend medications in addition to lifestyle. I definitely recommend that you consult with your physician and you ask all the questions. And before you go, make sure you look at my playlist or go to my right here on the Dr. Frita channel and look at Diabetes Explained, where I go into detail about pre-diabetes, diabetes, all of those things. On my videos, I also have videos on the best foods for if you have diabetes, the foods to avoid, okay? To avoid if you have diabetes or pre-diabetes. I go through those things and how to be a label watcher and what grams of sugar to have, all of those things. So check out those videos, educate yourself, and then consult with your physician.
All right. Thank you, Dr. Frita. I'm going to leave with a request or from one of your viewers. She asked, one moment, let me get back to her. This is from Brenda.
Hi, Brenda.
Can you speak on fibroids, and the video on fibroids and other procedures women can do other than a hysterectomy? So maybe it'll be a recommendation.
Okay, I got to put that down for fibroids, because I know historically, especially with women, probably a generation ahead of me, probably in a generation of my mom and my aunts, a lot of women have hysterectomies, and I'll be like, oh gosh, did you have cancer? And they'll be like, no. Why'd you have it? Oh, fibroids. And I'm like, oh. Well, was your anemia, was it very, very severe? No, it wasn't that bad. So I do know that a lot of people have, in the past especially, have been given, boom, hysterectomy as if it's the only choice. But there are other choices, like uterine fibroid embolization. And that's something that's pretty non-invasive, right? Something that an interventional radiologist can do, where basically they find the blood supply that's going to the fibroid. Okay, they find it, looking under the imaging, okay, the radiological imaging, and they're able to put a substance in there to cut off that blood supply to the fibroid. The fibroid shrinks, bloop, you can get rid of the fibroid that way. Now there's different, it's not as simple as that to qualify, because there are certain qualifications. If you have a super huge fibroid, that might not work for you, but it's at least an option for you to ask your doctor about, right? And then you have procedures where literally the doctor can go in and remove the fibroids themselves, a myomectomy, without having to give you a hysterectomy. And they can make it where, especially if you're of childbearing age, where you can still potentially have a good, healthy uterus to have babies. You don't have to get a hysterectomy. And of course, there are situations where hysterectomy may be indicated, right? But you want to make sure that you've explored all other options if you don't want to have a hysterectomy, especially if you still want to have babies. So, okay, so we'll put that on the things to do list on the fibroid surgery. I do have some women's health videos. I definitely have one on cervical cancer. So make sure after you finish watching this live, you watch my video on that on the screening. And, we actually do have a vaccine, the HPV vaccine, that is now being found to prevent cervical cancer. Okay, cervical cancer that's caused by HPV, human papilloma virus. So that's something that's pretty life-changing that's happened in my lifetime. All right. So that'll take us on out, Shador.
Yes, ma'am.
All right. Y'all make sure y'all click that members only. Come join me, y'all. Come join me for our next live Q&A, because we could, that little last part at the end. I love the live Q&A. Oh, I just love doing this Medical Monday. I do. And I love y'all, everyone who comes and who supports and who interacts. And I really feel like the information that we share and the questions that y'all bring up to me and the points that you bring up that I didn't even think about, I know that we're helping people to live their healthiest, happiest lives. So I thank you and I look forward to seeing y'all on next Monday for another Medical Monday. Make sure, in addition to subscribing, you hit that notification bell because I'll be releasing more videos, and you'll be among the first to know. And as I mentioned before, check out Instagram because today I'm putting in a video. It's going to be my part 1 of medical messages found in Megan Thee Stallion in her words, where I talk about what her mother passed away from, which was a brain tumor, warning signs of a brain tumor. After that, I'm going to talk about her getting shot in the foot, which I don't appreciate, but I'll go into the details of that. But I'll do that in a separate part. All right. Thank y'all for joining. Love y'all for watching. And we will see you next Monday. Thank you, Shador.
You're welcome.